Good afternoon. It is my great pleasure to be with you today, surrounded by good friends and colleagues. We're here today at the invitation of John Hickman, the supervisor of the town of East Fishkill, and his right-hand person and also good friend, Janet McHugh, who is the liaison to the town supervisor, and she is a member of our Southern Dutchess Coalition. I would like to thank them for their efforts in allowing us to come back to the table and to invite us back for an extended lecture series around a topic that you will hear today is of great importance to all residents of East Fishkill. As I've said, my name is Elaine Trompetto. I'm the Executive Director for the Council on Addiction, Prevention, and Education of Dutchess County. We are the only licensed prevention, education, and counseling provider in Dutchess County. We are licensed by the state of New York, the Office on Alcoholism and Substance Abuse Services. We are also the county contract agent for the Dutchess County Department of Mental Hygiene. As I mentioned earlier, I am surrounded by faces that have been at the table for a while and some new ones as well. And I'd like to welcome everybody to the table today. Our purpose here for today's event is to be able to bring growing awareness to a topic that is challenging many families, not only in Dutchess County, but in the Mid-Hudson Valley in general. And that topic is substance abuse. 2 weeks ago, the federal government provided designation to both Dutchess and Putnam counties as high-intensity drug trafficking areas. What that essentially means is the federal government has recognized, based upon data that comes from a variety of sources, law enforcement partners, medical practitioners, hospital emergency rooms, that point to the fact that overdoses as they relate to prescription drug abuse and also heroin abuse are at all-time highs. And in order to begin to build community awareness around this topic, we are gathered here today at this table. I'd like to take a moment to introduce my friends and colleagues. To my immediate left is the Chief of Police, Town of East Fishkill, Kevin Keith. Kevin also has his place at our table for the Southern Dutchess Community Coalition. To his left is Susan Feeney. Susan is the Director of Counseling Services for our agency, CAPE. To her left is Ray Duriti. Ray is actually with Phoenix House, and he is the community liaison, and Ray has been joining us very willingly for all of our forums. To his left, to Ray's left, is Anthony Eck. Anthony Eck is an adult in recovery. Anthony, too, has been volunteering with CAPE around this issue that we're going to discuss today. To Anthony's left is Pat Rosa, a CAPE board member, and also the parent of a son, Christopher, who lost his life to prescription drug overdose. And to Pat's left, the newest member of the group, is Susan Salomone. Susan comes to us from Putnam County, our immediate neighbor, and Susan and her husband, Steve, have put together over the course of the past couple of years a grassroots community action agency in Putnam, Drug Crisis in Our Backyard. Susan, like Pat, lost her son Justin to an overdose. So welcome. We're hopeful today that you will walk away with information that you have not had in the past, and it will be the beginning of a place to ask questions and have further conversation. So let's begin. Kevin, what I'd like to do now is to have you, if you would, share with our home audience your perspective from a law enforcement perspective on the substance abuse issues that are facing East Fishkill in particular.
Well, some of the things that we're seeing as a police agency, we are seeing a lot of activity in the prescription drug area. We have had a lot of occasions where we arrest people who are merely in possession of prescription drugs. We've tried to address this issue on various levels. We have a member who's in the Dutchess County Drug Task Force, and they aggressively go after people who deal drugs and you know, perpetrate this whole problem on our younger people, on people who are just starting to get addicted. We also, at our level, at the East Fishkill Police level, we come in contact with a lot of people for mere possession. It's not uncommon anymore to find a kid with not only a bag of marijuana in his pocket, but a couple loose pills. And we're seeing that more and more often. So, you know, these are the things we're trying to address. We work collaboratively with CAPE, the school district. Sue here is in the schools as a counselor at John Jay. We work with our courts. We have a program, Teen Intervene, which is designed through CAPE, and it allows us to channel people who we have in young people who are in high school when they're caught with alcohol or drug violations. We work with the judge, Judge Irene McElhaney, and she actually, as part of her sentencing, refers them to the drug counseling at school that Sue provides. So that's different levels that we're trying to address the problem. We're really not looking to put people in, incarcerate people or put people in jail. Many of these people we recognize have addiction problems. They're not necessarily bad people. They start out most often with legitimate prescriptions for injuries or illnesses, and at some point, if they abuse those, then they find themselves hooked, and they sometimes end up moving on to other drugs such as heroin when they can't get the pills. So we're trying to stop this at the lowest level possible. So that's basically where we fit in.
Thank you, Kevin. Sue, would you talk a little bit about the intervention services that are available, which Kevin just touched on, in collaboration between the East Fishkill Court, East Fishkill Police Department, Wappinger Central School District, and CAPE?
Sure. So we implement Teen Intervene, which is an evidence-based program. It's a brief intervention program designed for youth who are experiencing mild to moderate problems related to substance abuse. And I work individually with the students and incorporate family work as well to engage the family in order to help the youth recognize the negative effects of their substance use. And the end goal is to kind of motivate them to make changes, recognize the harm that it is having on them. And it's a good program. It allows the professionals to kind of speak with students who are getting in trouble outside of school and kind of focus more on the problem rather than just penalize them for getting caught.
Would you just mention briefly, Sue, the evidence-based nature to the programs that are provided?
Sure. So we implement Teen Intervene and Project Success, which are evidence-based programs, either through Hazelton or SAMHSA.
I just wanted to highlight the evidence-based, the science-based nature of the programs that we offer through CAPE in collaboration with the partnership that we have between the town and the school district.
Right, so we're always implementing programs that have been researched, have been implemented in schools, and have kind of evidence behind them as to being successful in either increasing motivation for change, increasing the youth's ability to see the harm and risk factors related to it, and also to decrease use.
Thank you. Mm-hmm. Ray, you're the treatment provider at the table as a representative of Phoenix House. Could you give us your perspective from your world on what's happening with this substance abuse challenge that we're facing?
Well, at Phoenix House, what we are actually seeing is an alarming increase in both the acuity level and the variety of substances that are being used by young people in the northern suburbs. So compared to, the 5 boroughs, with the exception of Staten Island, there's been a marked increase in both the intensity level of the substance abuse, the types of substances that are being used. We talk about heroin and opioid, prescription abuse. There's a marked increase in that. We also have the CDC survey results at 28 states that reported there were 3,655 overdoses in 2012 from heroin alone in 28 states, plus another, I think it was 9,700 overdose from pain medication prescriptions. So part of what we're seeing is that there is a much greater likelihood of young people from the suburbs, from middle-class families that are accessing and having these drugs made available to them.
Can you talk a bit briefly, Ray, if you would, about, for our home audience, the signs and symptoms that folks should be taking a look at or may want to pay attention to?
I think the key signs would be just beginning to isolate. You know, it's hard as a parent to differentiate between typical adolescent, you know, wanting to break that dependency piece and wanting to become independent. So I think as a parent, to look at, are they losing interest in some things that they were passionate about, you know, whether it be, you know, music or, you know, acting, sports. So if you're seeing a change in attitude towards things that they were passionate about, that they were involved in, looking from a faith-based perspective, if they're not attending church or services, if they begin to drop out of youth groups or certain types of positive, affirming activities that promote self-esteem and self-growth, if there's a change in friends. So I think as a parent, you know, you begin to see some withdrawal from certain types of situations, both familiar, family functions, school functions, sports, community functions. That's usually a sign that something is beginning to happen. You know, to me, that's the key.
So look at those changes, but don't overreact.
Correct.
But sort of look at it within the framework of the challenges, the particular challenges that we're here at the table talking about today. And seek help when your gut tells you to seek help.
Absolutely. You know, I'm a firm believer, once again, of a mother's intuition. You know, as a parent, you begin to get that feeling in your gut that something isn't right. And as difficult as it is, we need to begin to confront it and access the community resources that are available in the early stages. Because one of the things that I say to everybody all the time is I get involved towards the end. And the beginning took a very long time to get to the point of the end. So it's just so important in those beginning stages to intervene, to access help, to talk to people, because that makes such a tremendous difference as far as the outcomes go.
So when I come back to you, Ray, what I'd like you to piggyback on is your comment about accessing resources. And I know you've talked about that before at our forum, so hold that thought.
Okay.
The next three folks at the table are important voices, a new friend and old friends. With that, I'd like to introduce Anthony. Anthony has been tagging along with us at CAPE since our first meeting 3 years ago, I think. And Anthony, why don't you speak a bit about your own personal story, what led you to reach out in terms of what you were seeing, particularly with young people, and what you're involved in today to help as a volunteer to raise awareness.
Okay, thanks for letting me share, Elaine. As we all know, I'm a person in recovery, a little bit over 10 years. When it comes to addiction, things like that, alcoholism, I've been around it my whole life, from friends to family to my whole life story, you know, so I'm no stranger to it. I also make 12-step meetings, which keeps me sober to this very day. One of the things I noticed, and what I'll call it, is the trenches, being in the trenches. What I saw was, in the Bronx, you had a lot of people coming to meetings that were between 35, 45 years old. 6 years ago, I noticed up here in Dutchess County that they were coming into the meetings between 15 and 25 years old. Then it broke my heart. So something's got to be done. What's going on? You know, I started looking into it, and I wanted to do a little bit more. Made a few phone calls. Somehow I got linked up with you and Cape. We had a meeting, and you says, you know, I'm sure I could find something for you to do. And you did. You called me on it, and I'm glad you did. One of the things I've learned from the Council on Addiction Prevention and Education is that big word, the prevention part of that word. You know, being in the trenches, I hear 1,000 stories. Everybody's, and for the most part, they're all the same story. And they're all sad. And no one chose to have an addiction. It just somehow ended up that way, whether it was the decision, good, bad, or DNA. Call it what you will. But after getting involved with CAPE, I noticed that the prevention end. A lot of this could have been prevented. I mean, you're not going to stop all of it, but a lot of it can be prevented. If the parents get to the kids younger, at a younger age, if like you talked about, certain signs, if they see those signs, don't be ashamed to call your kid and to call that bluff if your kid's isolating or something. You know, one of the reasons why, from what I see in the trenches, that it's not happening is there's a stigma attached to this. You know, that stigma, it's those words that was just like in the New York Post the other day, the junkie teacher, you know, who got caught. That word junkie, bum, dope fiend. I heard that at a drug forum. I use the phrase dope fiend. With language like that, and because of that language, if you're a parent, you know, and you don't want your kid labeled as that, you really don't. You don't want that. So it makes you a little bit more ashamed, so you go into what I call denial aisle. You know, so you're a little slow to react. You know, the kids themselves, once they're hooked on this, I look them in the eyes and they tell me, I don't want to be on this anymore. But they don't want to raise their hand and say, hi, I'm such and such, you know. I also speak, you know, they try to change the language on that stigma. I speak to a lot of parents as well. And I'll try to tell them, you know, if you're sitting at a table and you're talking about one of your neighbor's kids, don't phrase it as, did you hear about such and such? Their kids are junk. You can't, you know, change the language around and say, did you hear about such and such kids? You know, they're suffering from this addiction. They started taking this. You know, so I think if we could change, with the prevention under it, change the language of it, and make people aware that it is a disease. You know, mental, physical, spiritual. It really is. You know, I made choices years ago when I was a kid, and this is where I ended up. You know, now I'm on this side of the coin. I like to stay there, but if with the prevention, and if we could change the language, you know, we could make them not so afraid to come out of that closet or that darkness, and say, hey, we got to get help. I think we do have a problem here. You know, that's one of my biggest goals.
And I think everybody at the panel today would agree with that goal, largely because over the course of the last decade, perhaps more, we've learned about the biological nature of this disease. And we hear the word choice often associated with this disease. And as you've just so eloquently said, Anthony, nobody wakes up in the morning and says, I'm choosing a life of addiction. Nobody does that willingly. So there's a lot of work to be done on that issue. And I think forums like this and anyone who can get that message out can change the social norms in a community. And I think we have to attack this one community at a time and then broad base it. I mean, a good comparison is the AIDS epidemic. That started with the same kind of stigma, prejudice, as have so many other diseases. And so we have stories of success that show that it can be done. So I would venture to guess, and correct me if I'm wrong, everybody at this table would agree with what Anthony's just said. While we all wear different hats at this table, ultimately we do, at ground level, need to change the way people think about this disease. My next two guests, Pat Rosa and Susan Salamone, are strong voices and have important stories to tell, not only about the personal challenges that they've experienced, but also what they've done in following those personal challenges and how they targeted their energies on the heels of those challenges. So, Pat, would you begin and talk a bit about what led you to the table today, oh so many years ago? How did you get here? Why did you choose to do this? And what are you hoping for the future?
I came from an elevator at the Poughkeepsie Grand. I was in Leadership Dutchess with Dr. Melody Mordock, who was on the board of CAPE, and part of that class is to join a board. And I had no idea what I wanted to do, but I had a mission. I had just lost Christopher in 2007, and I was angry and bitter, but I needed to redirect that energy in a different way. So when Melody said, I have the perfect board for you, I came to hear what CAPE was all about, and I knew that that was going to be part of my mission, because had I known that you existed when Christopher was going through this, my story might have had a different ending.
Tell us a little bit about how you honor Christopher today, and you've just said how you channeled your energy in a more positive way. One step was to become part of a larger mission with CAPE, but you also took another step. Can you tell the home audience a little bit about that?
Well, I think what Anthony said is spot on, that addiction is a disease and the stigma associated with it. I didn't want to admit that my son was addicted to drugs, and you lose a lot of friends and a lot of neighbors when you're going through that, when you need those friends and neighbors most. So after he passed away, I knew that I had to reach out to children, and Christopher had a mean sweet tooth. There were always kids in my house. I was baking all the time, and he would bring in a horde of teenagers, and it wouldn't even get off of the cookie sheet or the cupcake pan before they were eating them on me. So I thought about it, and I said, what better way to honor him but to start a business in his memory and donate a portion of the proceeds to CAPE. So I started Forget Me Not Cupcakes. And I had no idea what I was going to call it, and that just came to me. I'll never forget him. So Forget Me Not Cupcakes was the perfect name. And I go around, now I have a cupcake bus, and I take it wherever anyone will have me. And at each place, I tell his story. And I tell them that, prevention and education are key. I love to talk to the kids that come. Cupcakes and kids go together. And I know that I've made a difference, because every time I speak at a forum or take the cupcake truck somewhere, someone comes up and says, you've just changed my life. So I know that he's watching over me, and he's a part of everything I do.
Thank you very much for sharing, Pat. Susan, our neighbor in Putnam.
Yes.
You have a personal story to tell as well that actually brought you to this kind of venue and has you involved in the work that you do. Could you tell us a little bit, like Pat, about your personal challenge and how you took that same energy that Pat just described and what you did with that for the positive good?
Okay, Elaine, thank you for inviting me to be a part of this panel. I also lost my son Justin on May 29th, 2012 to a heroin overdose. And we dealt with his addiction for about 10 years. And we knew that he was addicted because he lived with us, and he started at 19. He was young, but it was a spiral downhill. It was pills and then heroin at 23, 24, and he so wanted to quit, and he couldn't. And I liken it to being in remission when he did quit, because he'd quit for months at a time, and maybe Anthony had the same experience and then relapsed. And finally, he did pass away. He did not want to be he didn't want to be addicted to drugs, but in the end, he couldn't stop. So after he passed away, we met with another couple that had I wrote an article that went into the Mayapack News about heroin addiction and how my son died. And we also didn't know this was going on. I mean, this happened in 2012, and we did not know that there was a problem with pills and heroin in our community. And so I wrote the article. Many people called us, but one couple that called us, Carol and Lou Christensen, had lost their son that morning, June 9th. They were burying him. It was June 14th the article came out. And so we got together and we started Drug Crisis in our backyard, and we had our first event August 9th, 2012, and we had 200 people show up. And so then we knew that a lot of people were hiding. And it became our mission to bring awareness of the rampant use of opiates and heroin in our community. That is our mission. And to let people know that this is really a brain disease. So we've been working for 2 years at it, and we're getting we really have a tremendous amount of momentum right now.
Speaking of that momentum, speaking of that momentum, I'd like the two of you to talk about the role that you see policy playing in the prevention and treatment of this disease. Pat, I know you tagged along with a group from the Southern Dutchess Community Coalition to visit our lawmakers in Albany. Susan, I know that you sit on a newly formed work group committee for the state that's beginning to take a look at insurance and what are the barriers associated with insurance when it comes to treatment. So, Pat, could I have you speak about your trip to Albany with some other parents from the Community Coalition, and then Susan, if you would follow with your experience thus far regarding the insurance. Pat?
I think our road shows, as we call them, are very important, and we visited just about every politician in Dutchess County, and when we were invited by Senator Gibson to go to Albany, we jumped on that because we had met with him in his local office and educated him about the epidemic that was going on in Dutchess County, but he wanted to know more and he wanted to know what we were doing about it, and I think that's made a huge difference by reaching out to the politicians and educating them. They've jumped on board and they're helping us to change policies, and I think that's going to be huge.
And Susan, I would suggest that your ability to sit shoulder to shoulder with folks at this work group in Albany also has the potential to change policy or to change the barriers that we know exist. We hear from our families that, particularly over the course of the last couple of years, folks were being sort of directed to outpatient first, and it was being viewed as if you didn't succeed in outpatient, then you would potentially get into inpatient, and even that inpatient was restricted in terms of time. So talk a little bit about the value, if you would, of this insurance group, what you're hoping for from this group, and how you see that having an overall effect on doing good things to support the treatment of this disease. Because we've talked about prevention, and prevention does work. But we are faced with a crisis before us where people need treatment. And if there are barriers in the way of that, that's not going to work too well for families. So can you talk a little bit about the insurance, Sue?
Yes, I can. I'd like to say first that I am not an expert on insurance, and I have a master's in counseling, but I do not have, I'm not even an expert in drug addiction, except for the long, extended experience I had with my son. So I would like to say, first, I'd like to tell the audience that the governor launched a new website. It's called combatheroin.newyork.gov. And I would recommend that they watch the governor's address, because when you listen to his address, you understand that New York has an epidemic with heroin and opiates, because we are one of the top 10 in the country with the amount of heroin that's being confiscated. Mm-hmm. So it's really important that people understand that this is really happening. So I have here, Elaine, the law that was, the governor signed into law 12 bills in June that were related to insurance treatment and addiction, heroin addiction in particular, and opiate addiction. And the law that he signed in setting up this work group, I'm just going to read that if you don't mind, because I think it really shows that our government understands what has to be done. It says within 30 days of the effective date of this act, which was sometime in June, the Commissioner of the Office of Alcoholism and Substance Abuse Services, Superintendent of the Department of Financial Services, and the Commissioner of Health shall jointly convene a work group to study and make recommendations on improving access to and availability of substance use disorder treatment services in the state. The work group will be co-chaired by such commissioners and superintendent, and shall also include, but not be limited to, representatives of the healthcare providers, insurers, additional professionals, individuals, and families who have been affected by addiction. The work group will include, but not be limited to, a review, and then it identifies the goals of the work group. Mm-hmm. So we had our first meeting in September. I just got back from Italy, and I had to go the next day. I was like, whoa, I was definitely jet lagged. But it was a fantastic meeting. I can't believe I'm really even in the group, because I'm surrounded by people that have so much experience. And the person that is running the group is Robert Kent. He's the general counsel. And the last meeting, I think there's about 44 people in the group. We introduced ourselves and said what we expected of this group, and we're meeting in Albany throughout this year. And by December, there will be a recommendation made to Governor Cuomo to change the laws having to do with insurance. And some of those laws have already been enacted into bills, but this is more recommendations on creating locators that will be uniform throughout, for every provider to be using the same locators, so they will know what step a person is when they come in for assessment.
So I hear you saying they're trying to standardize their access a little bit more to make systems easier to navigate?
Yes, that's one of the things that is on their agenda. There's like about 7 things that have to be done during this year. And one of them is methods for developing quality standards to measure the performance of substance use disorder treatment facilities in the state. So they're going to bring the treatment, not only is it going to be the intake that's going to be standardized, but the outcomes are going to be standardized, so that we can measure how the treatment facilities are doing, so that insurance companies are not paying for treatment facilities that are not working.
Right.
And that's, I guess, part of the problem now. And the fact that it is a revolving door is, Ray can attest to the fact that people come in and out of recovery.
Thank you, Susan.
You're welcome.
So, Ray, on the heels of what Susan just said, clearly we've been together enough so that you've heard me use the word evidence-based and outcomes-based ad nauseum. Would you say, based on what Susan has just talked about, that the kind of evidence-based applications that have us marching to that tune in the prevention world are being increased in the treatment world along the lines of what Susan just mentioned in terms of this work group? Tell us a little about evidence-based, if you would, and outcome-based measurement in the treatment world.
Right. One of the things that's transpired in recent months is the initiation and development of, quality standards to look at and measure overall. Success is really the wrong word, because it's an ongoing process, but to be able to effectively evaluate the overall efficacy of certain forms and types of treatment. So what's happened now is, with the introduction through SAMHSA and NIDA of evidence-based programs that are well-researched, with follow-up survey measures to ensure and include the fact that they work, treatment centers are now beginning to incorporate some of those models and use some of those evidence-based practices, because in turn they've been fully researched. They were developed by a team of qualified professionals from different fields within mental health and addictions, and they work. And so that's what we're seeing. And the idea with the insurance companies is part of the issue is that and many times there was a model that they followed. The model was you do a short-term detox, and then perhaps, if need be, a short-term rehab, and then get them back into the community for outpatient. But what's happened is, because our communities are so overwhelmed with not just the number of cases of people that are developing issues with abuse and addiction, but between waiting lists and so on, what's happened now is that long-term thought of this is how we should do it has now begun to change. So what we're doing now is we're looking at and becoming more flexible in looking at that different types of individuals need different types of treatment. and it's not just one size fits all. And so that's part of the reason with the inclusion of evidence-based practices that now we've been able to get it to the point where there are certain practices that we will use for opiate addiction. There are now certain things that we use for marijuana addiction. You know, so what begins to happen now is that we're able to pinpoint and target specific areas that work for people coming into treatment, and using these evidence-based practices and these particular groups and programs really target what is needed for each individual. So it's become much more individualized.
Thank you, Ray. We've been talking about policy and how when you look at policy change, it truly is a huge player in making changes to systems. With that, Kevin, I'd like to jump to you for a moment, because we know more than I think it is a couple of years ago, our Attorney General put a strong push behind iStop. Can you talk a little bit to our home audience about your perspective of iStop? And also, we've been talking about increased access to treatment. There is a bit of decreased accessibility that iStop focuses on. And could you talk a little bit about that as well? Because I know the East Fishkill Police Department does have a drop box at their location.
Well, starting with iStop, that's basically an electronic program put in place by the state where when people come into pharmacies with prescriptions, the iStop electronically checks that person's history, what other prescriptions have they been getting, how often have they been getting them. So we eliminate that whole the pharmacy shopping or the doctor shopping. It wasn't uncommon when it comes to prescription abuse or opiate abuse through prescription pills, where someone would be transported to one hospital one day, they get a prescription for Oxycontin or some heavy-duty painkiller. Then 2 days later, they get transported to another hospital. They'll pick up another prescription, and then a couple of days later, they may go to a third hospital, and they would stockpile all these Oxycontins, either for personal use or for sale. And what iStop does now, it allows the pharmacies to see electronically that, oh, wait a minute, you were just given a prescription a couple days ago, and then they would follow up with a phone call to the doctors. And now I believe this also links the emergency rooms in the hospitals. So if someone comes in today, a doctor can see that, oh, wait, you were at St. Francis, well, no longer St. Francis, but you were at another hospital a couple days ago for the same pills. So it's really put the kibosh on people, doctor shopping or hospital shopping or pharmacy shopping. So we've really seen a constriction on people obtaining prescription illicitly. But what the backlash to that is people who are now addicted to these types of pills start to seek an alternative, and unfortunately that alternative usually ends up being heroin. So even though we're bringing down the prescription abuse problem, we're going to see a tip of the scale to raise the heroin abuse problem.
Could I say something? Would you?
Yes.
Also, the doctors are being monitored.
Yes.
It's not only the pharmacists. So the doctors now are being monitored, so they're less likely to overprescribe, and that is really so
That's a wonderful thing.
Yeah.
Because we did see some overprescriptions.
Eric Christensen's mother, when she came over to our house when we first met, she brought all his prescriptions.
Yes.
And he was getting them all from the same doctor. And there were hundreds and hundreds of painkillers. And now that doctor like that cannot do that anymore because he has to put it electronically into the iStop tracking system.
And I certainly hope that's the case. But in response to that, we also have a 24/7 medication drop box. For those people that do have medications, a lot of times you may be prescribed a 30-day amount, but you really only need 10 days of it. Well, when you have those things, you don't want them laying around where someone else could get a hold of them, abuse them, they could be stolen. You want to discard those as quickly as you can. And we have a 24-hour drop box in the lobby of the police station. People can bring in prescriptions, not only those, but any prescription that might be laying around the house that you don't want laying around there where someone might get their hands on it. You don't want to discard these things in the toilet or in the sink because they tend to contaminate your well or your septic systems. So bringing them to us and putting them in our drop box is really the safest way to go. And then at a certain point, we bring these up to with our usually take my evidence guy, and we go up to the Dutchess County Resource Recovery Site with a huge incinerator, and we see that they're incinerated. So there's a chain of custody and a certain amount of security, so we know these things get destroyed properly. So we're doing our part in that respect to trying to get rid of this on the prevention level of trying to prevent these things from getting out there in the community.
And Kevin, what assurances can you offer our audience because of the stigma that we've talked about? I think law enforcement oftentimes is viewed in a negative light, and because of the stigma attached to these drugs, can you let our audience know that they're not being filmed when they come in, they're not going to be questioned when they come in, that it's simply a drop-off to remove the prescription drugs?
Oh yeah, it's totally anonymous. The only thing our dispatchers at the window are going to ask is to make sure you take your bottle with you, because we don't want your name or your prescription in the bin. We want the pills, put them in a Ziploc bag, we deposit them, and you take the bottles with you. You can destroy them however you want. We don't really want people's labels.
Sure.
But there are other things besides the pills that we do take. A lot of people have these fentanyl patches. Sometimes people are reluctant to bring those down because they are patches. But fentanyl is a very strong drug, and there's ways it can be abused. So if you have these fentanyl patches, a lot of times people with shoulder injuries, back injuries, and the fentanyl relieves the pain to the muscles. That's a very high a high-powered medication that we would like to get off the street. So if you have those, by all means, bring them in, and we'll destroy those as well.
Thank you, Kevin. Ray, I'd like to pick your brain again. We've heard about decreasing the accessibility of the prescription drugs, and that's been a prevention initiative. And you heard Kevin just mention that obviously with iStop and that monitoring that is now occurring, the accessibility of prescription drugs are becoming less common. They're not gone, but they're less common. So for our audience, can you talk a little bit about why the transition to heroin, the similarities between the two drugs? Because I'm not sure everyone knows that, and why it is a quick shift to the heroin.
Well, Vicodin, oxycodone, OxyContin is basically heroin in a pill. So it comes from the poppy plant. It's the same exact thing as heroin. What happens now is that the prices have skyrocketed, so you're paying $1 a milligram for a pill. So if it's 30 milligrams, $30, $40, $60, $80. Heroin is cheaper than it was in the 1970s and the 1980s. It's going anywhere between $8 and $12 a bag, depending on the area that you go into. So what's happening is that with the use of the internet, kids going online, kids interacting, what's happening is normally people get money together, somebody has a car, they drive to a neighborhood, they pick up the drugs, they bring them back, and they disseminate them amongst the group. So with heroin going down in price, but also increasing in potency, which is a very important factor. So when we look at, some of even marijuana, the potency level of the drugs that are available now is much, much higher than it was 5, 10, 15, 20 years ago, which also, causes a drastic increase in how quickly somebody can really become dependent on something.
One of the things we've seen from the reports that we get from our public health commissioner is the overdose rates, and how, and certainly this is true in Putnam County as well, and how those have skyrocketed, depending on where you're looking, anywhere from 200 to 400%. That being said, they haven't leveled off or decreased a whole lot yet. Would any of you on the panel like to chime in and say, what are your thoughts on the iStop that's been introduced, the increased awareness that we're all now doing from each of our own perspectives? What is your hope going forward regarding this particular challenge, substance use disorder, knowing that Dutchess and Putnam now share a classification from the federal government as a high-intensity drug trafficking area? This is a beginning conversation. What do you see as the best hope for our communities going forward? Anyone? Any brave soul who wants?
I'll start.
Okay.
I'm not afraid to talk. By the way, I'm a mother with a mission.
Me too.
Our hope is that we can change a culture. And we can only do that by having meetings like this and keep talking about the problem, keep talking about it as a disease. Because as long as people are afraid to come out because of the stigma attached to it, this is going to stay under wraps. So our hope is, I mean, Governor Cuomo, by coming out with this address, has really made this public. He has brought these PSAs, in the public service announcements, into people's living rooms. And there were 4 PSAs. There's 2 recovering people in long-term recovery and 2 mothers. I'm one of them. And people keep saying, I see you on television. And I keep seeing the other person on television. And this is going to make a difference. People are going to realize that this is really happening. And just like with what you mentioned about AIDS, it's going to change the way they look at it. Because this is happening in many, 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 many families that are willing to come out and talk about it. So our hope is that as it becomes more and more familiar to people, more and more people will come out and talk about it. And as the drugs are not available because of the I-Stop law, it's going to take a period of time to move these people that are already addicted through the system, and either whatever's going to happen to them, I can't say. But whatever happens, the younger ones are going to be better educated, so that that big curve that Dr. Kolodny shows us on his graph will begin to come down. That's our hope.
Kevin, I think you wanted to interject.
Yeah, I was just going to say that, like the saying goes, we think it'll get worse before it gets better. I'm hoping we're coming up on the top of the worst hill, and we're coming to with groups like this and more dialogue and the stigma being reduced. I'm hoping we're coming over that hill to where it's going to get better. That's my desire anyway. But some of the things, as you were talking about education and trying to get, I think we need a lot of buy-in from parents and family members. It's not unusual when we arrest a kid and he's got a couple pills in his pocket. The parents come in and they're angry with us, and it's like, this is an opportunity.
Yes.
We're identifying a problem here. Take the opportunity and seize it, and get your child help, or get your loved one help, whether it's your wife, your husband, your kids. This is a chance to burst the denial bubble, and we understand that. We understand when your kid's got an addiction problem, they're not necessarily bad people. They're usually kids that we already know from school or from the neighborhood, or we know the parents. We're part of the community too, and we see these kids, and we know they're not bad kids. And so everyone gets angry with the police because they think we're stigmatizing their kids. For an example, just last weekend, we had a brother and sister that overdosed on Xanax. And the parents were angry with us because we're trying to find out where they got this stuff. Apparently it wasn't theirs. And everyone's angry with us, and they don't want to cooperate with us. But I hope, when at the end of the day, they went and got some help for the kids. But it's that let's direct your anger for good, and let's identify this is now a problem and we need to do something about it. And I want to just, use that as an opportunity to break the denial.
So community problems require community solutions.
Absolutely.
And it takes every stakeholder to be able to address the enormity of a problem that is currently before us, which allows me to circle back. I told you I was going to call you on the carpet, Ray, and I'm going to do the same thing to you, Susie, to talk a bit about resources. Susie, I'd like you to elaborate a little bit more on the collaborative partnership that we have right here in the town of East Fishkill, which Kevin has alluded to a little bit, as a resource. And then, Ray, I'd like you to talk about, which you mentioned, I think, at our John Jay Forum and also our RCK Forum, about the wealth of services that are available within Dutchess County. So, Susie, if you would go first.
Okay, so again, we have a collaboration with East Fishkill as far as students.
And for the benefit, Susie, of the home audience, Can you talk a little bit more, give people a frame of reference? What is this animal called Teen Intervene? What does it look like when you receive a referral from Judge McElhaney? What is that process like?
So Teen Intervene, it tends to be about 6 sessions with a student, and sometimes that leads to more sessions with a student. Sometimes it leads to referral out for treatment or individual counseling outside of school. At least one session, the parents are brought in to meet with the student as well. And it's a lot of it is focused on them kind of recognizing what are the problems I've already had that's related to my drug use. How did my drug use start? Who else am I affecting by this? And, a lot of them come in saying, well, I could stop if I want to, but we really kind of break it down into how hard would it be for you to stop or, not pick up in the following situations. So it's a lot of kind of interactive work between the counselor and the student. It's not, just a typical counseling session. There's actually like worksheets that they fill out that you're kind of doing together, and kind of forces them to be involved, which can be good because they're not always coming in really interested in counseling necessarily. They just want to get out of this charge that they've gotten. But a lot of times it kind of brings up for them what the bigger issues are. Usually, again, they didn't just start using for no reason. There's usually some reasons around why they're using. We can kind of get to the deeper issues. And, sometimes they feel like they were unfairly caught, and we talk about that and how it's a kind of a social norm and kind of changing their ideas about social norms. A lot of it's also focused on coping skills, so a lot of them are using this as a way to cope with other stress in their life. So we work on, okay, so what else are you interested in? And maybe what's something you were interested in before you got really involved in this drug use? How is this affecting that? So all of that kind of comes into play. So again, to me, it's a much better use of their time than maybe something that was used before when they just kind of got in trouble and had to do some community service, which can be positive, but this also kind of breaks down the
Well,
issue.
this is an evidence-based program, and what it does is it allows an assessment of sorts to occur and determine what's needed. Is it going to be short-term, or is there anything long-term that the counselor believes should happen as a result of those sessions?
Haley, maybe Susie can talk about the Marathon Project a little bit, too.
I won't put Susie on the spot. What I'll do, the Marathon Project is a very unique program that operates through the Council on Addiction Prevention and Education. And the program was selected as one of 26 programs nationally by the Substance Abuse and Mental Health Services Administration to sort of take us by the hand and walk us towards making that program evidence-based. It is underwritten by the Dyson Foundation. It's been in place for quite a while, and we are inching our way forward to be able to get that title of evidence-based attached to it, and it looks hopeful. It looks like within the next year, fingers crossed, we will be able to do that. And Pat's energies have been directed to that because Christopher was a runner. So I'm glad you brought that up. Thank you, Pat. Ray, I'd like to skip to you and the resources piece, and then I think what we'll do is we'll sort of bring this to closure with final thoughts. And so we'll take it from there. So Ray, if you would, I'd like you to elaborate just a bit on the comments you made at both John Jay and RCK about your perspective of the wealth of resources that are available, in particular in Dutchess County.
One of the things is that here in Dutchess there are a number of different routes and roads to take to intervene, and many of them are completely confidential, and many of them don't involve any type of judgment. And as a parent, sometimes you hope against hope, or you really believe that things may get better or will get better, and oftentimes they don't. And so that's why it's just so important to intervene and address it as it happens. Because the sooner you intervene, the sooner you address it, the more likely you are in a positive outcome occurring. What we find is the younger the intervention, if someone's only using for, 6, 8, 12 months compared to 2, 3, 4 years, the likelihood of a positive outcome and long-term recovery is much greater the earlier the intervention. So there is a helpline available. which Elaine can maybe speak a little bit about. That's completely confidential, that's anonymous. There's school personnel that are available that you can speak to, a family member can speak to, a neighbor can speak to. There are community support groups that are available, forums that are held. So there are so many different ways to intervene and address this and work with this that in many communities there's not. In many communities, people struggle with trying to figure it out or make phone calls. Here, those services are available to you. And I would strongly encourage you to pick up the phone or go online or stop in and talk to someone. Because as I often say, I get involved in the end of this situation. And, so many young people are writing their beginnings now. And we have the ability to intervene and change the ending now. But we need to act, and we need to do it as quickly as we can and as soon as we can. And, Susan talks about destigmatizing, and, it is a disease. It's nothing to be ashamed of. It's nothing to be embarrassed about. But, it's almost every week someone is dying or someone is overdosing. We had somebody who died last week in Dutchess from a heroin overdose. And it's just going to continue unless we as families, parents, concerned friends and neighbors really take the initiative to pick up the phone and get involved and call someone.
So would all of you agree that the mission of folks like us at the table today is to change the culture, to change the social norms, to make certain that that shame, blame, and guilt that has been so unfairly attached to this disease needs to go away? And in closing, what I'd like to ask of each of you is, what advice would you give to the folks who are listening to this presentation at home, wearing the particular hats that you're seated at the table with today, and the role that you have in the work that you do to address this disease? Do you have a message for them? Kevin?
Well, as Ray alluded to earlier, there are always warning signs. And we see this, usually by the time we get involved, something bad has happened. But we do see these warning signs on a family level, on a community level, where if you're a parent and you notice jewelry missing, you notice cash missing from the house, you notice things don't seem right at home and you suspect your child's got a problem, I would implore people to deal with it right away, because if the problem starts to expand outside of the home and it starts affecting neighbors and it starts affecting where your family member, I won't necessarily say a child because sometimes it's a husband or wife, where it starts affecting your community, where they're stealing from other people to support an addiction, then it's come into where we're going to be brought in. And of course, we don't want to put people in jail. The courts don't want to put people in jail. It's an addiction problem. It's not, you're not Bonnie and Clyde. You're out there, hopefully doing petty things to try and support addiction, and we can correct that. Or we hope that with some support, these people can correct that and keep and not expand into where they're doing more serious crimes. But if you can catch this while it's still in the household and recognize it for what it is, then you can get them into some kind of treatment before the police get involved. Because we'd really prefer not to have to deal with people that are addicted, only because we'd like to see them get help. So,
thank you, Kevin. Susie, as the school-based personnel through CAPE in Wappingers, Kevin is talking about early intervention when the problem presents itself. Could you make a very brief case on the heels of what Susan and Pat said about how early that intervention should really start beginning? And clearly there aren't enough resources to address it, but for the families of young people out there who might dismiss this conversation as irrelevant to them, how would you speak to that group?
I think it's important to bring up this topic before it becomes a problem, no matter, how great of a family you're from, or how much money you have, or where you live. I think it's important to talk about, well before high school, and that, those conversations can take a number of different routes, and also not falling into the thinking pattern that this can't happen to our family, and if we talk about it, that's going to cause it.
I'm going to put you on the spot, and Ray, you can chime in on this as well. I think parents have sometimes want to keep a distance from that conversation. How early would you both recommend that kind of communication, and I don't mean drilling down on heroin and prescription drugs, because we all know healthy choices discussions begin at much earlier age levels. When should the health and wellness discussions, I mean, we've heard in some of our forums, and I think it was you, Ray, that mentioned at RCK, we talk about stranger danger when they're entering kindergarten. So how do we address this issue? And how soon do you think those conversations should begin? And I'd like both of your perspectives.
I think as early as possible, just showing your child to respect themselves, to take value in their own wellness, to develop healthy coping skills. All those things don't even have to bring up the word drugs, but are actually a form of prevention.
Ray, you want to chime in?
I would agree with Susan that the sooner the better, and I think it also starts with role modeling. Modeling as parents, as family members. Modeling appropriate behavior. Letting, if an incident occurs or a situation develops, whether it be at a family gathering or something in the community, to sit down and have that discussion or have that conversation with your child from a very early age. I really think that in turn sets the foundation for the building blocks to continue to build. But as a parent, I think, at a young age, once they're entering school, once they're old enough to comprehend or understand, to really begin to talk about some of these issues.
Anthony, I know in your volunteer capacity and in the paths that you travel, you bump into a lot of young people. What message would you deliver to parents, families that are listening today?
One of the first things I want to throw out there is when talking to the younger people and getting a brief history on when did this all start. It all had one common denominator. They all started smoking marijuana first. And I'm just going to throw that out there. That's that common denominator. So that's the first thing that's going to get you some sort of buzz. Mm-hmm. And every one of them so far has said that. I think if you're not afraid to tell your kid, don't get in a car with a stranger because you think you're going to scare them, or they might be too tragic, or little Susie shouldn't get in a car with some guy who says he might have a puppy or something. Don't be afraid to teach them. Now, as a parent, you're not a pharmacist, so you can't break down what drugs are and chemical compounds and things, but there are ways of doing it. And I found things I think we had discussed, things on YouTube that parents can go to. You can type in heroin before and after. You'll see a 12-year-old kid that she's beautiful, and then 2 years later she's got no teeth, and you can see the damage. And I think the kids at a very young age, can see it visually. Just say the word drugs, bad drugs, things, check with me first. Just let them see that visual picture. Because obviously if you tell your kid don't talk to strangers, there's some sort of fear factor. Mm-hmm. So let them see something on a video. I tried that with several parents that asked me on the thing I've been doing on the weekends, my little traveling mobile road show where I go from town to town trying to educate people and bring out awareness. And I've gotten feedback saying, I just watched this with my kid, it was unbelievable. And then we went from link to link, and they kind of got the message. And I said, what I tell them is just keep chiseling away at that. Plant that seed, just keep planting. Mm-hmm. That prevention goes a long way. Again, if it's in your family tree, it's even harder. Not saying it's not going to happen, but you got a better shot at educating them as young as possible.
Right.
As young. I mean, 5 years old, 6 years old. They're already at 5 years old, they can play every video game and use a smartphone, which I can't even do. So they're old enough to know what you're talking about.
Sure.
And I leave that up to the parent, their discretion,
So we've been talking about resources, and what I want the folks who are listening to us today know is that they can visit our website. We have a resource tab that lists everything from state level to federal level, and people can pick and choose. It's a menu of sorts. It's all credible information. It will address the county level services that Ray made mention of. It will talk about, in some form or fashion, all the things we've touched upon today. That website is www.capedc.org. So to bring this to closure, I think the families in our audience are probably very interested in the final comments that Pat and Susan would have, because personal stories open up not only our hearts but also our heads, and it gets people thinking. And if we're trying to shift culture and change social norms, the fact that you two ladies are at the table, as well as Anthony, is a first step in that direction. We need to bring the professionals to the table because people need to know where to get help and what is the backdrop for the services that are available. But sometimes, and I know both of you have said the same thing, I heard Pat, I heard Susan say tonight almost verbatim what you say when we go on the road, I'm a mom on a mission. So I think the three of you have a particular message for our audience. So as parents who have been down this difficult path, what would you say to the families in our audience that are listening to this tonight or this afternoon or whenever they're turning it on? Pat?
First of all, I want to say that every school district needs to have CAPE in there. I had the pleasure of going with the community educators to a 4th grade class, and you talk about talking to children early. I was blown away by the questions that these 8-year-olds were asking. So they're exposed to drugs at a very early age, and I think school districts need to find the money in their budget to have CAPE in there as a prevention effort. To the parents, I'd say, never say this can't be my child, because my child was in scouting and sports and wasn't the greatest in school, but he was a DJ at the age of 10. He was a great kid and smart and funny, and it still happened to him. So watch your children, watch their friends, and encourage them to speak up. If they know of someone who is using drugs, I know they don't want to rat on someone, but they may just save another child's life. So.
And Susan, I'll give you the final word.
Okay. What I would say is this is not a rite of passage, and parents really need to understand that they should not be saying, well, we did this. And I also agree with smoking pot, whoever said that. Anthony, you said it. Every parent that we speak to that lost their child, they started with pot. My son started with pot at 16. The other thing I would say to parents, my kid was a loner, and he was afraid to take risks. I would say to parents that have young children to speak very frankly with their teachers to find out if they are different from the other kids in the class. Because very often this is something that goes along with some kind of behavior problem they might have. They might have a lot of anxiety, which in retrospect my son had. They might not have good coping skills. That's something that needs to be identified at a very young age, because it needs to be changed at a very young age. And I would say that I think about what we could have done differently every day of my life now, and I'm sure you do too, Pat. And so I would say look at them as young children, talk to their teachers very candidly, don't only listen for the good stuff, and remember that this is not a rite of passage. These drugs are very, very, very dangerous. And people that are predisposed to this, which is a very large percentage of the population, will get addicted to pot and move on to stronger drugs.
So I think it's safe to say we've all got a lot of work to do. But I would also say that the collaboration and partnership over the past few years that has emerged from this crisis hopefully has taught us some lessons that we do need to address the problem that's before us. There's no doubt about it. And the kind of treatment changes with the insurance backdrop that we talked about earlier hopefully will deal with those issues head on. We need to provide, once someone is in recovery, the necessary support for that recovery. But this is a preventable disease. And if it's preventable, we know what folks do to prevent heart disease, high blood pressure, diabetes. This is no different. Some of the interventions may look different, but this is no different. And the earlier the assessment and intervention, the better. I think the message, what I'm hearing from all of you say is, we've got to cast aside the shame, blame, and guilt. We've got to change the language attached to this disease. We've got to make it okay for people to talk as freely about their young persons or their own challenges with this behavioral health issue, substance use disorder, as it is to talk about anxiety or depression or any of the other host of mental health issues. We know that the World Health Organization has indicated in a lot of its literature, based upon its research, that by the year 2020, the single biggest cause of global disability will be mental health issues and substance use disorder. That is 6 years away, folks. Coming up on 5. Everyone in the community needs to have their part in this, from the individual to the family to the community organizations to the policymakers. And I do believe that because it's reached the level of crisis that we've reached, many of those stakeholders are not at the table. If I had a parting wish, I would like to offer, and I think our efforts would support it, that we don't repeat something like this again going forward in the face of another drug, because I don't think it's necessary. The resources need to be applied to enable the services that are necessary so that folks like Pat and Susan and their families and the children that they lost do not have to face this challenge going forward. And I believe that's doable. But it is going to take change, and it's going to take resources. So with that, I would like to thank each and every one of you, because I know I pull a lot of you to the table over and over again. So I thank you for that. I appreciate it, because the perspective you've provided to our audience today is useful. This isn't just a family discussion. It isn't just a person in recovery's discussion, or a treatment, or an early intervention and prevention, or law enforcement. It's everybody's issue because it affects everybody in our community. So with that, I would like to extend my appreciation again to Janet McHugh and John Hickman for their welcome to have this panel and to continue an ongoing education series. I can't thank the folks enough who came to the table. I would encourage anyone listening to this, if you need further direction and assistance, please feel free to contact our website, www.capedc.org, or call us directly if that's easier for you, 845-765-8301. Thank you for your kind attention, and hopefully you can be our audience for future events.